Hi, I'm Julia Schwinghamer, and today I am doing my IV Piggyback and IV Push validation. Okay, character. Okay, so before I go into my patient's room, I'm going to look over her chart. So I see that my patient is Llewellyn Sanderson, date of birth 117XX, who has an allergy to sulfa and a high fall risk. She has morphine, acetaminophen, dextrose, and at 0.45%, infusing at 100 milliliters per hour, and also has potassium chloride and normal saline infusing. Those are her medications. It's important to note that she has a heart rate of 95, blood pressure of 134/82, respirations of 19, and 9 out of 10 pain. Otherwise, her physician has ordered us to go in there and put morphine in the IV as IV push, and then also go in and piggyback some potassium chloride onto her IV. So that is what we are here to do today. Now that I've reviewed the chart, I'm going to do my first med check on morphine. So I'm first going to make sure that my patient is Llewellyn Sanderson and her date of birth is 117XX. That's true. Review allergies, which are sulfa, not in the morphine. Then I am going to make sure that it's the right amount. We have 2 milligrams over every milliliter, which is also 2 milligrams per milliliter, and we do have 1 milliliter here in the vial as well. This is ordered for every 4 hours when she's feeling pain, 7 out of 10. And so she is feeling 9 out of 10 pain, and she has not had this medication within the last 4 hours, so she is ready to be administered medication.
The IV push validation.
All right. So then I'm going to go into, I'm going to document that I'm doing this, and then I'm going to go into the patient's room, gathering all my supplies. And I'm bringing them all with me. So now I'm knocking on the patient's door. Knock, knock, knock.
Come in.
Hi, Llewellyn. I am Julia, and I'm going to be your student nurse today. Before I go any farther, I just want to make sure, could you please give me your first and last name and your date of birth?
Llewellyn Sanderson, date of birth 117XX.
Perfect. So I'm going to just make sure that is correct with her wristband as well, and then I'm also going to check that on the MAR. This is the right patient, so I'm going to go ahead, first of all, wash my hands, do some good old hand hygiene, and then I am going to get into educating Llewellyn about morphine. So Llewellyn, it sounds like you have 9 out of 10 pain that was reported. Are you still feeling that pain?
Oh yeah, it hurts really bad at my incision site. Is that one?
Sure. Sounds good. Okay, so that sounds really uncomfortable, and we want to make sure that we can get that pain down, which is also going to help lower your heart rate and your blood pressure and your respirations and just make you a lot more comfortable.
Oh, sounds great.
Awesome. So the medication that was ordered for you is morphine sulfate. With morphine, we really want to make sure that you are letting us know if you're feeling dizzy, confused, if you're seeing any rashes or any pain that wasn't there before the medication. We really want to hear that. Also, another thing to keep in mind is that morphine can make you feel pretty constipated, so we want to make sure that you're getting in enough fluids, and we are you're gonna have to let us know if you're not having any bowel movements, and maybe we can help you out with that. All right. So, do you have any other questions about morphine?
No, I think I'm good.
Okay. Would you like to take the medication today?
Yes, please.
Awesome. I just want to make sure really quick, do you have any allergies to any medications?
Oh, I'm allergic to sulfa.
Okay. I do see that here on my MAR, and sulfa is not contraindicated with morphine, so we are all good and ready to go ahead and do this IV push if you're ready for it.
Yes, ma'am.
Okay, so now I'm going to do my second med check, and I'm going to make sure my patient is Llewellyn Sanderson, date of birth 117XX. So Llewellyn, or could you give me your first and last name again along with your date of birth?
Llewellyn Sanderson, 117XX.
Perfect. So then I am also here, and I am checking the wristband as well. So we have right patient. That is the right patient. I'm gonna go ahead again and check that allergy, just making sure I have like a really tight eye on that. And looks like we're good to go. Then as I'm doing my med check, I'm also gonna make sure to check out this vial, make sure everything looks fresh and good. And while I'm also doing that, I'm also going to check out my IV site, and I'm going to make sure that everything does not look inflamed, red, itchy, painful at all. I did ask her earlier if she had any extra pain, and she said no, but I'm just going to make sure again. Llewellyn, have you had anything that you were not expecting with your IV site?
Nope, it's all good.
Sweet. So I'm going to make sure it looks like nothing is kinked. This is going in well. This also looks good, fresh, not expired. And the IV site looks clean, healthy, everything looks good. So I'm gonna go back to the medication. That also looks like it's definitely not expired. The expiration date is on there, and we are good to go. It also looks like it has not been tampered with, and there's no sediment in there, so it looks like we're good to go. Then I'm going to make sure that we are going ahead and we're wanting to do morphine, which is correct. We want that as IV push, that's also correct. We want that 2 milligrams per milliliter, that's also here on the drug. And we do have 1 milliliter of it here in the vial, so that's good to go. Now, this is ordered every 4 hours for pain. She has not had this drug in the past 4 hours, and she does have pain 9 out of 10. So there we have with our right time and right indication. And then I just want to go ahead and make sure that I'm documenting this correctly. So now that I've done my second med check, I'm going to go to the bed. I'm going to take my supplies with me along with the MAR so that I can do my third med check here at the bed. So again, I'm going to make sure Llewellyn Sanderson, that's right on the wristband, and the date of birth is also 117XX. Perfect. I'm also noting again that sulfa allergy. Then I am noting we are here to administer morphine, 2 milligrams per milliliter. We also have that there every 4 hours. This is the right time. For pain, this is the right reason. And now we are going to go ahead and document this and then go ahead and administer. So now I have done my 3 med checks and I'm ready to administer morphine per IV push. So I'm going to start by doing hand hygiene and putting on gloves. Now I'm trying to be very careful and make sure that I am keeping both these fleshes and the tip of this vial sterile, but I'm going to put this here out on the bed so I don't have to open up this bag while I'm trying to do a clean movement. Okay, so I have my IV here. And then I am going to kink this part so this isn't currently draining into the arm. We're going to start by cleaning off this port for 15 seconds. Okay, 15 seconds has gone by. And then we are going to flush this 10 milliliters of solution in. I'm being very careful to keep this sterile along with keeping the port sterile. I'm going to slowly push this in over. Now I'm going to discard of that into the trash. And then I am going to go in with the morphine, and I am also going to make sure that I'm keeping this tip of this vial sterile along with the port sterile. I'm going to attach the two, and I'm going to administer this 2 milligrams of morphine over 1 minute. So I'm going to push this in for 1 full minute. Okay, it's been a minute. And then I'm going to discard of the vial as well. And then I am going to go in there again with the vial of solution, another 10 milliliters, and I'm going to make sure to keep this sterile and this sterile as well. Attaching again. And then I'm going to push this in at the same rate that I pushed in that 2 milligrams of morphine. Perfect. Now that I push those in at the same rate, I am going to unkink this IV, throw that away, make sure that this is not kinked, everything is draining at the correct rate. Perfect. Make sure that Llewellyn feels good. I'm also going to discard of my gloves and do some hand hygiene while I'm talking to Llewellyn. All right, Llewellyn, so it looks like we have that morphine administered. You should be starting to feel an edge being taken off of your pain pretty quickly here within the next minute or two. Do you have any other questions about that?
Nope.
Okay. So I am going to put up the bed rails, put your call light next to you, and then it looks like we do also have to get a piggyback IV going with some potassium chloride. So I'm going to go out, check on that, and then by the time I come back, we should be able to see if you're feeling a little edge being taken off of your pain.
Super.
Awesome. Okay, so there's your call light. Be sure to let us know if you are experiencing any of those adverse effects that we talked about, such as confusion, dizziness, nausea, vomiting, and yeah, if you're feeling uncomfortable at all, just let us know what we can do. I'm going to put both of the side rails up and make sure the bed is as low as it can be to provide for safety. I'm going to do hand hygiene again, and all of this stuff is in the trash. I am going back out to to get my meds ready for potassium chloride piggyback. So as I am out here and I'm looking at the MAR, I am going to again do a med check, my first med check actually, for the potassium chloride piggyback. So first we make sure it's the right patient. Llewellyn Sanderson, 117XX, that's right. Again, we're making sure that there is no sulfa in this potassium chloride because she does have an allergy to sulfa. Okay. So then we are going to, okay, we have 10 MEQs of potassium chloride in 100 milliliters of normal saline, 0.9 per IV piggyback. Okay, so yes, we do have 10 MEQs. We do have potassium chloride. All right, we do have this in an IV piggyback. And we have this for administered for now. Perfect, that's right now. And we want this to infuse over 1 hour. All right, and we are infusing this for hydration. Perfect. That is perfect. I'm going to document that I have these things, that I'm going to gather my supplies, and I'm going to head back into Llewellyn's room. Okay, knock, knock, knock.
Come in.
Hi, I'm Julia. I'm back again to get going with your IV piggyback. And I also just want to make sure that you're feeling all right after that morphine was started.
I'm feeling so much better.
I'm going to do a little hand hygiene. Okay, have you had a little edge taken off of that pain at all?
Oh yeah, I'm down to like a 3 out of 10 now.
3 out of 10, that's great to hear. Are you feeling a little bit more comfortable?
Absolutely.
Okay, that's great. Okay, so as I come back in her room, I asked her about the morphine. I'm just because it's routine, going to check out the IV site, check out the line, make sure that there are no kinks. I'm going to, again, make sure that this piggyback that we're doing is not contraindicated with 5% dextrose and 0.5% sodium chloride. And it's not. So that's great. Then I am going to do my second med check here at the bedside. So we have our patient, Llewellyn Sanderson. Llewellyn, could you give me your first and last name and your date of birth, please?
Llewellyn Sanderson, 117XX.
Perfect. I'm just going to make sure that there is no contraindications with an allergy of sulfa with potassium chloride, which there is not, so that's great. We are ready to go. And then I see here on the order, potassium chloride. Yep, potassium chloride, 10 MEQs, 10 MEQs. Ordered for now, which is right now. This is per IV piggyback, which is what we are about to do. And this is for hydration, which is great. That is what we are here to make sure we can do for her. So now that I've done my second med check, I am going to go ahead right up next to the bed and I'm going to do my third med check before I administer this. So I have Llewellyn Sanderson. She has an allergy to sulfa. We're making real clear that we don't have any contraindications with that. Then we are here to administer potassium chloride, 10 MEQs of it per IV piggyback right now, and the reason is for hydration. Perfect. So now that I've done my 3 med checks, I'm going to go ahead and start my IV piggyback. So I'm going to do hand hygiene and get some gloves on. Llewellyn, do you have any questions about this potassium chloride that we are going to be infusing here?
No, I don't think so.
Okay, so this drug is going to be used for hydration, and we're just going to hook it up here to your big bag up here. It's going to be a little above that, and we're just going to have both of them dripping in and hopefully going to make you start feeling real good real soon.
Sounds good.
If you are feeling like a super full bladder and no way to void, or if you're feeling super nauseous, or if you have shortness of breath or almost feel like you can't breathe, we really do want to hear about these things because those are some some adverse effects that could occur because of potassium chloride. But we're hoping to not have any of those things today, and if they do occur, please let us know. All right, so I'm going to go ahead now and start my piggyback. So I'm going to start actually by putting this a little lower. Okay, and now that I have that done, I'm going to get my supplies out for the piggyback. So gonna make sure that's clamped. Perfect. I'm going to try and keep all of these things clean. I'm going to pull that, pop that out, and then I'm going to try and keep both this port and this sterile as I attach the two. throw that away. Push this here into the port. And make sure again that this is fully clamped so nothing spills out. And then I'm going to go up here to this port. This is where we want that in, so I'm going to make sure that I can keep that sterile as well. I'm going to open up this alcohol pad. That's also going in the garbage. And I am going to clean that port for 15 seconds. I'm also going to clean the attachment for 15 seconds. And then I'm going to attach the two. Now I am going to back prime the potassium chloride with the dextrose and sodium chloride because I don't want to lose any of the medication. So I'm actually going to put this lower than this and open up so there you go. You can see it going backwards. Then we're going to pump that a little bit, make sure it's up to half. Gonna hang it high. Make sure that's infusing at the right rate. Make sure this is infusing at the right rate. Make sure there are no kinks on the way down. Make sure everything is open. Make sure it's infusing. And I'm going to ask Llewellyn, how are you doing as I take my gloves off and I do wash my hands?
I'm doing pretty good. Yeah.
Are you feeling any discomfort or anything unexpected with the new piggyback there?
Nope, I'm feeling a little tired, but I'm feeling good.
All right, I know I've been in here quite a bit, so I do kind of want to give you some rest. I just want to make sure that you remember that you can press this call light if you need anything. So I'm going to put that here for you. And then I also just really want to remind you if you're having any of those symptoms from either the morphine or the potassium chloride. Well, that's like fully draining out. I'm going to close. If you're having any of those symptoms that we talked about, to please hit that call light, let us know. We want to come in here, make sure you're comfortable and you're safe. I'm going to put up the two bed rails and make sure that call light is next to you. Make sure the bed is as low as it could possibly be. And I'm going to wash my hands one more time. Ask you again, do you need anything from me?
I'm all right.
All right, so I'm going to be back in here in a few minutes to make sure that all of this is infusing correctly. But please hit your call light if you need anything. Thank you.